I'm Maureen Kelly. I'm the Chief Nursing Officer here at Roswell Park Cancer Institute. I have responsibility for nursing practice for all areas of nursing in the organization, as well as the management of all of the inpatient units and the operating room. As you know, this is Oncology Nursing Month, and we are celebrating all of the wonderful nurses at Roswell Park who take care of our very special patients. I always consider being a cancer nurse as a privilege. We're lucky to take care of the patients that we serve here at the Institute in many ways. Some are inpatient nurses, some are OR nurses, some are ambulatory care nurses, some are in the ancillary departments or in research. But we're all very committed to the mission of the organization. You know, I always believe that the qualities of a cancer nurse are slightly different than an average nurse who may work in other fields. The reason being is that you have to have your clinical skills. There's no question that's important. But compassion is number one. You really have to have the empathy and compassion in working for patients who are going through the most difficult time of their lives, often in a life-threatening situation, and also involving their family and their friends. So we really become somewhat part of their Roswell family while they're here. So it's so important to, number one, I think that compassion counts the most. In addition to compassion, I think an oncology nurse just has to have that right personality. They have to be a people person. They have to be able to work through very difficult emotional times. And again, if patients need a support, they need empathy, they need someone, a shoulder to cry on, that's the Roswell Park Cancer nurse that you want. You know, as I make rounds all the time and meet with patients and families, they often say, what can I do to recognize my nurse or my nurses? And now we have a formal program. It's called the Daisy Award. It's a national award started by the Barnes family, who after they had a tragic event in their family member really respected and was grateful for the care that nurses had provided. So we recently had our first award ceremony, and I have to be honest, there wasn't a dry eye in the house because patients and families wrote their suggestions and their nominations, and many of the patients came and read the nominations themselves, and it was so heartfelt and showed what an important part of their recovery their nurse was. And I loved when they said, my nurse, or my Roswell nurse. It's kind of like they really view them as they're part of their team in getting better. I think oncology nurses are very humble. You know, when we are supposed to brag and say, what do you do for your patients? Most of the nurses say, but it's just my job. It's just what I do. They don't realize, in my mind, what I think that they think is ordinary, I think is extraordinary. They go above and beyond. They give of their heart and their soul. And I think that at the Daisy Award, you saw how much the patients and their families, from young and from old, appreciated that. So that was a really proud moment in Roswell's history.